Hello and welcome to this online first aid training for children brought to you by the Tech Programme. During this training session, you'll be learning how to recognise child-related risks, prevent incidents from occurring, what to do in an emergency, and how to perform CPR. Feel free to take notes as you progress through the training, as there'll be a quiz at the end. Now sit back, enjoy, and learn everything you need to know about keeping kids safe. The course will begin with an introduction to first aid, and then cover risks and the methods used to reduce them. We'll then look at the importance of adapting your approach to first aid according to the age and build of the child. We will then cover the most common incidents and learn how to deal with them, and specifically look at the key steps when dealing with conscious and unconscious victims. Before we begin, let me ask you this question. What exactly is first aid? Read the 3 descriptions and decide which one you think is correct. If you selected the first description, then you are absolutely right. First aid is the immediate assistance provided to a sick or injured person until professional help arrives. It's important to understand that first aid is not used to replace professional medical help. An injured or sick person should always be consulted by a professional. First aid is important because it can increase the chance of survival when waiting for professional help to arrive. What is risk? A risk is the likelihood of something bad happening. We can't remove risk, but what we can do is reduce the risk of something bad happening. Let's take cycling, for example. We know that there's a risk of getting hurt. To reduce this risk, most people will wear a helmet, cycle in designated cycle lanes, and use lights when cycling at night. This is exactly the same approach that is needed when working with children. There are risks everywhere, and unfortunately we can't just sit at home and do nothing. We need to face them and find ways to reduce the risk and the likelihood of these bad things happening. For example, a child could fall, drown, choke, get electrocuted or burnt, get hit by something, or get heat or cold exposure. These are the risks that you are likely to encounter when working with children, so it's important to be aware of them. There are 5 key ways to reduce risks when working with children. We can remove the danger by making sure dangerous objects are out of reach. We can prohibit access. We can monitor the children closely, although this is not possible all the time. We can educate the children appropriately, and we can be an example of good and safe behavior. It's important to remember that your approach to first aid will be different depending on the age and build of the victim. For example, adults can be treated with more force than babies and children. When it comes to first aid, there are 3 key age groups. Babies are less than 12 months old, children are aged between 1 and 8, and any person over the age of 8 is defined as an adult. Would you know who to call in an emergency? In France, the emergency services function slightly differently compared to the UK, USA, and other countries. In France, most people call the SAMU, the Service d'Aide Médicale Urgente. This is the number 15 and puts you through to a medical expert. The number 18 connects you with the fire service. The number 112 is an emergency contact number that covers the whole of Europe. And the number 114 is specifically for individuals who cannot speak or hear and may need to provide emergency information via text. It may seem obvious, but it's also important to be prepared before calling the emergency services, as they'll need some key information. Always begin by introducing yourself and checking that they have your phone number so that they can call you back if the connection is lost. Then give your current address and try and be as accurate as possible. You'll need to summarize the situation and provide the current state of the victim. You'll also need to describe the procedures that you've already performed. And remember, don't hang up until you've been told to. Now we are going to look in detail at some of the most common incidents and how to treat them. One of the most common incidents is choking. Kids can often be excited to eat and forget to swallow properly. Choking is only dangerous when it blocks the airways and prevents the person from breathing. But how to know if someone is choking and needs your help? Well, normally they won't be able to speak, cough, or make any noise. They'll likely be holding their neck with their hands. They'll be desperately trying to get air by opening their mouth. They'll look very panicked, and their face may be turning red or even blue. If your victim is an adult, i.e. a child over the age of 8, smack them hard with the heel of your hand in between their shoulder blades while they are leaning forward. Put one arm around their chest and support them, and use the other hand to smack them 5 times. If there's no result, stand behind the victim and put both arms around their chest, with your hands landing underneath their ribcage. Push down and up in a swift movement. This should dislodge the object blocking the airway. A baby who is choking will be distressed and may be unable to cry, cough, or breathe. As babies are fragile, you must adapt the method previously explained. Start by laying the baby face down across your thigh or forearm and ensure that the head is supported. Give up to 5 firm blows using the palm of your hand in between the baby's shoulder blades. Then turn the baby over so that it's on its back, and using 2 fingers, deliver 5 firm chest thrusts inwards and upwards towards the head. Repeat the cycle of back blows and chest thrusts until further help arrives. Another common incident is excessive bleeding, which can result from a deep cut. You should use a towel and apply pressure with your hand directly onto the area. The child or baby should be lying down, and you should call the emergency services immediately. If a child has a nosebleed, you should ensure that they sit down with their head tilted upwards. They can begin by blowing their nose and then apply pressure by pinching it. If the bleeding doesn't stop after 10 minutes, you should contact the emergency services, as it could be bleeding from the brain. We've looked at a couple of common incidents, but what happens if you arrive onto the scene of an accident and you don't know what's happened? This is where the DRAB acronym comes into play. These 4 words will help you determine what type of first aid will be required. You will need to begin by checking for any danger relating to you or the casualty. Try and make the scene as safe as possible, and remember that you are the most important person. If you get injured, then you won't be able to help the victim. If the area is too dangerous, then stay back and call the emergency services. Once you've determined that the scene is safe and that you can approach the victim, you'll need to see if they're responsive. For children, shout loudly in both ears and tap them on the shoulders. For babies, flick the bottom of their foot. If you do not get a response, then the baby or child is unconscious. But what exactly does that mean? Being unconscious means a complete or near complete lack of responsiveness, and being unaware of both self and external surroundings. The difference between being asleep and being unconscious is that the person will not wake up. It's a medical emergency which requires immediate first aid intervention. When somebody goes unconscious, they lose muscle tone. This means they go all floppy, like a rag doll. The tongue can block their airway when it loses this muscle tone and thus prevent them from breathing. This is known as swallowing your own tongue and is very dangerous. In addition to this, loss of control over the stomach muscles can cause stomach contents, like vomit, to travel back up to the throat, which can block the airway. A variety of medical conditions and traumatic injuries can cause someone to become unconscious. However, at this stage, do not worry too much about trying to find out why they are unconscious. Your immediate aim is to open their airway and ensure that they are breathing. Once you've determined whether the victim is conscious or unconscious, you'll need to verify that their airway isn't blocked and that they are able to breathe. The airway is a series of tubes which carries air from your nose and mouth to your lungs. As mentioned, it can become blocked by the tongue or simply through the regurgitation of food or liquid from the stomach. This will stop the casualty from breathing and can quickly cause death. To check the airway, you need to place the casualty on their back. Place your hands on the chin and forehead and gently tilt their head backwards. With your fingertips on the chin, lift their mouth open, which will then open their airways. At this stage, you can check to see if there's anything blocking and remove it gently. Once the airway is open and clear, i.e. there's no tongue, food or object in the way, you'll need to check for breathing. This should only take 10 seconds. Keep your hands on the child or baby's head and chin. Place your cheek above their mouth and look at their chest. Look, listen, and feel for regular breathing for up to 10 seconds. Remember, you are assessing for normal breathing. The occasional gasping or snoring sound is not regular breathing and should not be treated as such. Once you've assessed whether the victim is breathing normally, you'll be able to perform the appropriate first aid treatment. So thanks to the DRAB acronym and its 4 steps, danger, response, airway, and breathing, you will now know whether your victim is conscious or unconscious, breathing or not breathing. Knowing this information will allow you to begin performing the correct first aid procedures. Let's first look at a victim that is unconscious and not breathing. Once you've determined that the victim is not responding and not breathing, you'll need to put them into the recovery position. Remember, you only need 10 seconds to check whether someone is breathing. You need to lift their head back gently, then place your ear near to their mouth and look at their chest. If they are breathing, you will feel their breath against your cheek and you will see their chest rising. The following video will demonstrate how to put someone in the recovery position. The person should be lying on the ground on their back with their head tilted backwards. For a child, begin by taking their right arm and tucking it around their neck. Move the left arm and put it at a right angle. Lift the right knee, then gently roll them onto their side. Make sure that the left leg is at a right angle and prevents the child from rolling any further. Double check that the head is tilted back and that either the hand or the arm is supporting the child's head and that the airway is kept clear. So we've established that when a victim is unconscious but is able to breathe, we can put them in the recovery position and then call the emergency services. But what should we do if the victim is unconscious, their airway is blocked, and they are unable to breathe? If you have performed the breathing test and are sure that the victim is not breathing, then you will need to perform CPR. CPR stands for cardiopulmonary resuscitation and includes 3 key parts. Firstly, breathing to allow oxygen to circulate in the blood around the body and brain. Secondly, pumps to replace the mechanical pumping function of the heart. And finally, defibrillator to analyze and restore an electric activity so that the heart can become autonomous. Before arriving at the point of performing CPR, it's important to remember that you should have already checked for danger, checked for consciousness, and checked for breathing. If you are with an unconscious victim who is not breathing and you are alone, begin performing CPR immediately, as you may be able to resuscitate the victim. If you are with somebody, one person can call the emergency services while the other performs CPR. The child should be lying flat on their back, their chin lifted and eyes looking up to the sky. Begin with 5 breaths, but do not breathe too hard, as the air goes into the stomach and may cause the child to throw up. After the breaths, do 30 rapid compressions with your arms straight and your hands placed one on top of the other. Then alternate between 2 breaths and 30 compressions. Performing CPR on a baby is very similar to a child, but you must be more gentle. Begin with 5 initial breaths, but make sure to cover both the baby's mouth and nose with your mouth, and then initiate the chest compressions, but only using 2 fingers, your middle and index finger. You must continue performing CPR until medical help arrives. If you're with someone, ask them to find a defibrillator. Defibrillators are devices that restore a normal heartbeat by sending an electric pulse or shock to the heart. In English, the device is called an automated external defibrillator. In French, a DAE, a défibrillateur automatisé externe. Defibs can be found in many public places, like metro stations, pharmacies, gyms or sports centres, and offices. There are also mobile phone applications that list all of the places that you can find one. Once you find the defibrillator bag, open it up and take the 2 pads out. For a child, place both pads on the chest. For a baby, place 1 pad on its back and the other on its front. Next, turn on the machine and follow the instructions. The machine will provide audio prompts and tell you exactly what to do, i.e. when to do compressions and when to provide breaths. Timing is incredibly important when dealing with an unconscious victim. In order to increase the chance of survival, you should have alerted the emergency services within 2 minutes, performed CPR within 3 minutes, used a defibrillator within 5 minutes, and have had medical assistance within 8 minutes. We've now covered all of the important steps required to effectively carry out first aid. Always remember to begin by assessing the situation, determining the state of the victim, and ensuring that there's no immediate danger. Next, alert somebody. In an ideal situation, you won't be alone, which means one person can call the emergency services and the other can attend to the victim. If the victim is unconscious and not breathing, remember to perform CPR first, as it may be their only chance of survival. If the victim is unconscious but breathing, you can put them in the recovery position, then call for help. If the victim is conscious and you have successfully unblocked their airway, you may not need medical help, but it doesn't hurt to consult a professional. You have now reached the end of this training. This was an introduction to first aid for children and is by no means a replacement for traditional in-person training. It's also worth noting that advice and guidance relating to first aid continues to evolve and develop, with new approaches and devices being discovered. So be sure to refresh your training on a regular basis. This training was brought to you by the TECH program, an interactive teaching and childcare program aimed at providing teachers with all the skills and tools they need to effectively teach and inspire young learners. Find out more at thetechprogram.co.uk.